Good morning, everyone. After two enlightening presentation, my work becomes much easier. And my work also becomes easier for the audience because I am mix of both the houses. So I'm a doctor, I'm an intensivist from pediatrics background. But my research area has been over the last 15 years on biomedical informatics, mostly on clinical decision support systems and wearable sensors. So why consumer-centric healthcare and how its relevance to what we call as analytics-driven healthcare in the world. And to this, and what we are doing in Xerox, I would just start with, what's health of health? Is health is healthy, or is health is really getting to the ICU? And I would say health is really in the ICU, and we do not have enough beds in the ICU. So state of health is really not good. And why is that? The world is getting heavier and older. That's a very profound statement, came from WHO as well as Nature, which means is we are burdened with metabolic syndrome diseases like CVD and COPDs and cancer and asthma. On the other side, the BRICA countries which are coming up, they are increasing a great degree of demands where acute diseases are coming into some control, but they are having a largest burden of chronic diseases. So we are living in a world which is filled with chronic diseases. And when I see this through the economic lens, I feel chronic disease, once diagnosed, the person has to die with the chronic disease, which means the face time it requires with the healthcare provider, with the patient, is quite phenomenal and quite high compared to acute disease when I treat it with antibiotics, or I fix a surgical complaint, or I do a retinal implant. Whereas the real problem, what this situation has led to the world is we have an enormous amount of face time requirement from doctors, from providers, from technology, which is just not there. So getting through normal way of treating health condition is just not going to be the way things are going to be. So over 20 years, we have been thinking about telehealth, technology-enabled health, and this is going to really solve the issue. But we have yet to see whether it has really solved the issue. If we just see about statistics, we do not have technology-enabled, analytics-driven healthcare solution that has transformed countries or communities or even big companies. What it means is we are somewhere going back to the basic, and why it is. If we go back to 1900s, all of us who are doctors here, we are taught prevention is always better than cure. And it had a great meaning behind it. What it means is earlier healthcare, previous to the industrial era, the doctor went to the patient, he saw the patient, he diagnosed the patient, he prescribed the patient and returned. Or the patient went to the doctor, the entire transaction happened over one sitting. Post-industrialization, what happened, we moved from point of care to distributed care. What it means is we had X-rays, we had ultrasounds, we had CT scans, we had big IT systems, but it needed also application specialists to run this. What it meant is the patient came to doctor, then went through various tests, and after that he went through again the treatment, which made the entire cost of transaction unsustainable. And we have been following that model till now, which is in today's world in health affairs, it's called sick care. We are trying to fix sickness, whereas what we are taught in healthcare economics, in preventive medicine, is to preserve health. So the real idea is if we just apply analytics to understand how many people are diabetic, or how many diabetics are going to have complications, or how many complications are going to end up in the emergency room, maybe that is just not going to be enough. Where a holistic approach has to be taken, where we need to preserve health instead of trying to fix sick care. So having said this, I don't want to paint a very pessimistic picture here. We have been talking about connecting health information from patients supporters, from providers, from clinicians, from population health, from genomics, to the doctor or to the decision maker or the policy maker who is making a decision. But all this has started happening maybe over 5 to 6 years as we started seeing the Fitbits, the Intel Health Guides, or the Philips Motivas, or there are systems which are now commoditizing the way healthcare data is acquired. But somewhere there is also a big mistake which is made is with this wearable revolution, we feel healthcare revolution is going to happen. But your wearable, which is going to give you an accelerator data or a diet data or a lifestyle data, is just not enough for a doctor to diagnose this severe chronic condition. So if at all we have to get into this assistive telemedicine to prescriptive telemedicine, what we call analytics-driven telemedicine, our data acquisition has to be comprehensive, which means not only wearable data, but all comprehensive vital parameters, along with genomics, along with population health, along with social profile, along with social economic profile, which arrives at a state what we call as a desirable or a personalized state. So this question I always get, that's why I put the slide explicitly where, you say Xerox, the Xerox is the printer company which is doing healthcare, so that's where I just want to, touch upon it. Xerox is a major player in US for healthcare, where almost every 2 out of 3 individuals we touch. It's a suite of companies, but to be focused on, it serves currently 39 out of 50 states in US to cater their Medicare and Medicaid. But on the other side, on the commercial payer and pharma also, we play one of the biggest roles. But what it really gets Xerox at the forefront in this analytic-driven world is we handle a huge amount of data, be it from pharmacy, be it from pharmaceuticals, be it from the payer, the provider, the genomics to the sensors. We get huge amount of data. And we have a suite of application, what's called MIDAS, which has been doing analytics-driven healthcare to predict all that things what we have been listening over 2,000 hospitals. So in this scenario, where we are looking for is arriving at this, what I call as consumer-centric healthcare. So consumer-centric healthcare has been described as a cohesive platform which is just not analytics driven as data is given and what is the meaning we are making out of it, but every person, I think this is really disturbing, every person as they are born, it's called a health equity state. So as we are born, based on our inheritance, based on our genetics, based on our socioeconomic status, based on our education, based on the environment where we are, based on the people who we are surrounded with, we are born with a health equity. And as we grow, our health equity grows to an optimum level when we are called adults, where a country or a community gets the real return on investment of having a citizen in the country. That's where, as unfortunately we have incidents of illness or sickness, our health state derives or deteriorates into an undesirable state, what we call sickness or illness episode. And then a treatment plan comes in to try to pull this person back to the desired state. And that's what we want to do, either with a comorbidity analysis or to identify whether this person is comparing with another 1 million patients whose genomics data I know, or I'm comparing them with comorbidity analysis of another 1,000 patients whom I know. So ultimate fundamental behind this is, can I identify a pure health state of an individual? If I can identify that, can I predict it? If I can predict it, can I provide him with a personalized care plan? So how it translates
Dr. Satish, I'm sorry, you'll have to close it.
Yeah, I'm done. So how this translates into our application is we get various sources of data, what has been told earlier by the speakers, and we convert them into suggestive platforms. So a hospital can know which group of patients to focus on, a doctors can know whether the ACO needs to coordinate with the readmission specialist, or whether this person is going to get into the ICU, or whether this person is going to get outside the ICU. So we are a lab who are present in Bangalore, as well as in Grenoble, in Park, as well as Park West in Canada. And these are few of our results, what I would definitely try to highlight here. So we do work before the hospital, inside the ICU, and after the person is discharged out of the ICU. And we have some pretty impressive results to talk about, where we can predict with a fair amount of accuracy based on Indian patient data whether this person is going to have a stroke, as well as we can predict very well whether this person is going to have an acute hypotensive episode, as well as we can predict the mortality, as well as we can predict the morbidity. So that's where I would say maybe I will leave with a few things. This I see is bringing India again back to the IT revolution, what IT made India and Bangalore is known for, and India is known for. Data is democratic. Genomics data population health data, these are democratic data. And the amount of population what we have in India, suddenly this makes us a very opportune place to play in consumer-centric healthcare or analytics-driven healthcare. So that I definitely want is going to help us. And more, I would suggest maybe to the analytics-driven company, physiological models and healthcare economics models are going to play the differentiation, and pure analytics-driven approach might be, falling short of the thing. So thank you very much.
Thank you, Dr. Satish. I would request Mr. Gopal Devanahalli, the Chief Operating Officer of Manipal Healthcare. So it'll be great if you can also give a little background about yourself, sir.
Sure. Just open. Good morning, everyone. My name is Gopal. I've been with Manipal for around a year. Before that, I used to work with Infosys for 15 years. So I bring in technology bent to healthcare. So I'm excited to be here. And we were all big data and predictive analytics is, as somebody just said, everybody wants to say that they are doing something about it. Everybody is excited about it. But there's so much confusion on what this actually means. Is it really business intelligence, which has been around for so many years? So what's so different about it is the question that we all keep asking ourselves. So I think it's very important that after you heard from my co-panelists who kind of laid the stage for what this is all about, what I wanted to talk to you about is what have we been doing the last 1 year in big data and predictive analytics, what kinds of pilots we've been trying out, and where do we think we believe we are going to invest in this space going forward. So that's what I'm going to present. Before I get into my presentation, just a little bit about Manipal. We've got around 15 hospitals. We're primarily a tertiary and secondary care hospital chain. We also have a hospital outside of India, which is in Malaysia. We have also several clinics through our Manipal Ankur subsidiary, which is focused on men's health and IVF. We have, and this is from a big data perspective, something which really interested me. 2 million people touched us last year. So that's the kind of numbers we're talking about. 2 million patients we've been serving on an annual basis. Of course, we have over 5,000 beds and several doctors and nurses. Our core values that we pride ourselves on are clinical excellence, patient centricity, and ethical practices. And the reason I wanted to mention that was when we are talking about investments in big data analytics, it needs to either make sense to improve patient excellence or patient experience, or it should make the life of our clinicians better. Otherwise, it doesn't really make sense talking about interesting, experiments if it doesn't really either benefit our patients or our clinicians, which is what we are focusing on. So I touched a little bit on 2 million patients. So there's huge amounts of data. Big data is all about, and why is it different from business intelligence? Really what we're saying is that data is, as some of our panelists have just said, so in the previous session also we heard about it, the technology has resulted in huge amounts of data being generated. Devices are generating data, patient visits are generating data, labs are generating data, so huge amounts of data. Our partners are generating data like insurance companies, etc., etc. The thing is, what are we doing with this data? And one of the biggest challenges, of course, is most of this data is not interoperable. They don't talk to each other. It's very difficult to make sense across data streams. But there is huge amount of data. Now, the approach we decided to take was, let's not keep saying, look, it's very difficult to look at this data and make sense out of it. Let's break it up. Let's take it as is and figure out what experiments we can do. And this is my advice, because if you're going to say that, look, I want perfect data, only then I'm going to start doing predictive analytics, it's not going to happen. We are going to have multiple sources of information in spite of all the talk we had in the previous panel about standards that are going to come our way. It's probably going to be a few years before those standards are going to happen. And more importantly, we all have legacy IT systems. We're not going to switch our legacy IT systems in a hurry because it's going to cost a lot of money. So we have to look for solutions which sit on top of these data sources, pull it all together, and then start doing interesting experiments. So that's what we should be looking at. Our broad, therefore, strategy is that if you look at it broadly, there are 4 things. And one is operation analytics. How can we use this data to look at process improvements or cost optimization, or even things like attrition predictors, because as many of my colleagues in this industry know, our attrition rates for our clinicians are very high in the nursing and paramedical staff. So how do you predict that? So things like that. How do you look at data to come up with models which will predict various kinds of things on the operation side? Second thing, which I think there's a huge opportunity, is on customer analytics to improve experience. And I'll talk about one of the experiments that we have done. So this is very critical. And this is easy to do, because most hospitals today, I think at least we have started capturing feedback, we get complaints, we get people are commenting on social networks. So all this data is being captured. So you can make sense out of that and figure out what is it that you could predict about improving the sentiment for customers. Then revenue analytics, I think Vamsi already touched on it. So there's a big opportunity to look at forecasts. Today, how do you predict volumes is typically over the last month or previous year kind of models, but is there a way to combine it with holidays, with publicly available information, weather information, information about religious festivals, etc., to start predicting volumes, and thereby then figuring out how your assets need to be utilized. So there are a bunch of things you could do. Today, a lot of people came late for the first session because of the traffic, and Google Maps actually predicts traffic load pretty well, as all of us know. But recently, Google Maps just announced that they're going to come up with a product to help predict restaurants, which restaurants are not so busy at that time when you decide to go out to have lunch, only because we don't have data today in a form which is easily analytical, easily can be analyzed. Manipal, for example, is now, over the last couple of years, we've been working on EMR, and that will make it much more easier. But otherwise, we have huge amount of data which is all scanned and lying in a HIS, but you really can't do much with it because of the situation of the data. But that's a big opportunity, huge amount of data. Most of us are sitting on it. It is monetizable. We can use it to not only benefit consumers and patients in India, but also, you can, for hospitals, it's actually a revenue potential also. So what are some experiments that we have done? I'll just quickly touch on it. On customer feedback analytics, what we've done is, and this is a predictive analytics thing I'm talking about. I'm not talking about regular business intelligence. What we did was, we've been collecting data in a digital form for customers for the last 1 year. We have something called NPS, which is, will you advocate Manipal or not, which is a simple question. But also there are a bunch of questions that we ask about, how was your experience with nurses, doctors, etc., etc. So almost 40 questions that are asked. What we did with the last 1 year's data is we used different kinds of statistics models to figure out what are those 5 or 6 key questions which will determine if somebody will become a promoter, that is, he's going to promote Manipal, or a detractor. That means he will go and say that, look, it's pretty bad. And we came up with a predictive model which was predicting almost 85% accuracy. So that was a model that, and a bunch of factors. So it was based on 6 key questions. Out of all those 40 questions, 6 key questions determined if somebody is likely to be a promoter or a detractor. And therefore we said, okay, this is good, but what do we do with it? So we came up with a concept of an interim survey. So a patient gets admitted. After 24 hours, we do a small survey only on those 6 questions, so that we obviously don't spend too much time on it, but we look at those 6 questions. Based on our model, it will predict whether this person is likely to be a promoter or a detractor. If it's likely to be a detractor, an alert goes immediately to our customer service team to go and do something there. So they go make an intervention, understand what the issues are. And we've seen over the last 3 months since this pilot is going on, that most of these patients, after they get discharged and then they give us a final feedback, they have actually moved up in the scores. So it's been working for us. So now we are figuring out.
Mr. Devanhalli,
yeah.
Still have to.
Yeah, I'll just finish.
Thanks.
Then the other one is on inventory management. And this some people have been talking about. And what we have done here is that we have a model which will look at, for consumables, in our stores in different hospitals, what is the possibility of stockouts based on historical data. So this is the other pilot that we've been doing, and then we've been doing some around operations improvements. So that's my presentation. Just one last comment I want to make. There are challenges in terms of adoption of using big data analytics. The challenges are in terms of the data types itself that I talked about, but that is solvable. And the other challenges is how do you actually look at small things that you can bite, show success, and then slowly roll it out across the company. Thank you.
Thank you so much, sir. I would request Mr. Shirish Sahai, the CEO of Wolters Kluwer's India.
Good morning. My name is Shirish Sahai. I'm the CEO for Wolters Kluwer. So I've been with Wolters Kluwer for close to around 4 months now. But before that, I had spent 15 years in GE Healthcare. So my topic is about clinical decision support tools in mHealth. But before I go into that, I would like to talk about a story, a real life story. And this story is about what happened just a few months ago in Nepal. And in Nepal, people in India also